First, I want to thank everyone for attending the American Society of Addiction Nursing, our monthly webinar. Every month in September, we do a Recovery Month webinar. And this month is called Journey to Recovery, Reflections and Lessons from Nurses in Recovery. This webinar has been approved for 1.5 nursing CE through the California Board of Nursing. At the end of the survey, at the end of the webinar, please complete the survey that you'll receive, and you'll receive your CE certificate at the end after the survey is completed. If you happen to miss a session, all of our sessions are recorded and archived on our website. If you attend an archived session, CE is available and you receive your certificate once completing the survey. And all of our webinars are free to ASAN members. So if you're not a member, we strongly encourage you to join. And if you aren't a member, we have a very small fee to join our organization, and we're open to both LPNs and RNs. Please keep your cameras on, and please remember to mute your microphone. Any questions? We're going to do a little bit of questions at the end. If you have any questions for the speakers, we can put them in the chat box. Okay, so these are the objectives that you probably already have read and seen before signing up for this webinar. I'm not going to read these to you, but I'm going to just jump into a little overview about substance use disorder in nursing, risk factors for the nursing profession, and then we're going to jump into the speakers that we have to present tonight. So we do know, most of us are nurses here on this webinar, that nursing is a high stress. We have high stress work environments. We see a lot of trauma. We see death. We're understaffed many times. We shortages, work long hours, sometimes 12, sometimes 16 hours. So there's a lot of stress in our jobs. Nurses also have accessibility to powerful medications and accessibility, at their fingertips. We also have a positive attitude towards medication and a low perception of risk to ourselves. And one of the other big factors that's a risk factor for the nursing profession is the enabling behavior of our coworkers. Many times a coworker will see their fellow nurse maybe come in impaired, isn't sure how to confront them, don't want to be responsible for this nurse possibly losing their job. If they lose their job, they could lose their house, they could lose their marriage, their children. So they're very reluctant to report colleagues to their supervisors. So we've known about SUD in nursing for many, many years. Believe it or not, Rob, in her publication, Nursing Ethics, Stress, Total Abstinence of Narcotics. And she wrote in her nursing ethics that nurses have access, and she's encountered nurses who lost control and became victims to drugs themselves. And 45 years later, the Bureau of Nursing Welfare fostered rest homes for nurses admitted with substance use disorder. And then finally, 82 years later, from when Rob first acknowledged the substance use disorder in nursing, the ANA passed a resolution acknowledging the problem of nursing impairment, and they developed a task force to address the issue in the nursing profession. And I will say that Florida was the first state to respond with the intervention project for nursing that is still in existence today. They were the first state to have an alternative to discipline program for nurses. And currently there are 45 states that have a ATD program in their state. And I believe most of us probably know on this webinar what an alternative discipline program is, but it's really a confidential voluntary program that allows nurses to disclose their dependence or impairment to an intervention project within their state. And the projects provide oversight and follow the nurses into recovery. And these are some of the components. And I always say, monitoring programs, when you've seen one, you've only seen one, because each program in each state is run a little bit differently. But these are some of the core components that the majority, or if not most of the programs have today across the United States. There's an evaluation period to see if the nurse is eligible and does meet the criteria to be enrolled in a monitoring program. There's typically 12 steps involved, 12-step attendance. There's treatment involved. There's monthly or quarterly reports Some states have them monthly, some have them bi-monthly, some even have them quarterly reports that the nurse submits on herself or himself on their work site monitor supplies a report, and their therapist or their treatment program supplies a report to the program. There's also random urine drug testing, and that can range from 52 times a year in some states to 18 to 24, 26, 36. It varies across every program across the state. There is also a return to work process that each program has set up individually for each nurse, and each program has their own return to work process, but this is all part of the process that kind of creates a safety net around the nurse. And there's also weekly support group meetings, and that's where I feel that most of the real work happens, where nurses can go to support groups, they can be with their peers, they can talk about, their shame and guilt, what happened, and they can and the other nurses can identify with them and offer support. And it creates a sense of belongingness for the nurse. So this is just a list of all the programs across the state. The only reason I put these all on here, so if anybody wants to download this, you can see all the programs and there's all the information. It's a whole list of them here, 45 states. And just update this list because this list wasn't complete. Utah does have a program. DC has a program for nurses. And some programs such as Hawaii, Michigan, and Rhode Island, they have some specific programs, but it's subject to board approval that the nurse may be able to enter. I do know for a fact that some of the nurses in Hawaii joined the physicians program under the approval of the board. And I just spoke with the director of Georgia. I don't think he's on here today, but they're introducing legislation to have an alternative to discipline program in their state. They currently have a peer assistance program, but they do have a board order. Those nurses do have a board order. They do make exceptions for a nurse who may self-report alcohol use without a DUI or impairment. They can be given a private consent. And the 4 states without a program are Alaska, Missouri, Wyoming, and Nebraska, and Wyoming. Okay, just to give you an update what's happening now across the United States, feel pretty confident most people know who the National Council of State Board of Nursing is. They are doing a study from 2017 to 2023, and it's a retrospective longitudinal analysis. And they're looking to see if referrals to alternative medicine programs change during the COVID period. So I do know anecdotally, speaking to directors across the country, that they did see their numbers go down in referrals during COVID. And some have felt that this is all anecdotal, have felt that this may be because some of the institutions were holding on to nurses because there was a nursing shortage. They may have been overlooking some of the signs and symptoms and trying to keep the nurses on board working. That I don't know to be a factual, but that is what some of the directors told me across the country. So that's going to be published in 2024. So we'll see how that results. There's also another study going on by National Council, and this one is really looking at guidelines. Like I said earlier, many of the programs across the country, if you've seen one, you've seen one. Every program has their own little uniqueness, that you may get tested 26 times, 52 times, 18 times. The program may be 3 years or 5 years. So they're looking at a select board of nursing. They're going to adopt these guidelines, and they're going to track the participant outcomes to see. And they're looking at, fostering a uniformed guidelines for nurses and alternative discipline programs. I know a few years ago that the physicians programs, the State Federation of Physicians Health Programs, they did this about 4 or 5 years ago, and they published their guidelines 2 years ago. So look for that to come out. Okay, so now we're going to move on to our speakers. And I do want to mention a few things about our speakers here. I do want to share that Michael will be our first speaker. And I happen to know Michael pretty well. A little bit about Michael. He has been a nurse for 17 years and has worked in a variety of settings, serving as a staff nurse as well as a supervisor and or director of units in the area of detox, psychiatric crisis intervention, trauma, and they're just few of the areas that he has worked in. Michael's currently works as an RN psych trauma level 2. Per Michael, he has chosen this as his area because it is his passion in nursing and the community he loves to work with. Michael has shared that he received that because of his recovery journey, was able to obtain his BSN and 85% of his APN. That's a work in progress, he said. He's also been able to be a responsible father to his beautiful daughter, who is now 20 years old, and he recently married his partner of 8 years. Per Michael, he feels none of this would have been possible without his attending his rehab, enrolling in the ATD program, and believing in a higher power. Before Michael goes on, I'm going to introduce all the speakers so we can move on. But Michael, thank you for being here today and volunteering to tell your story. I appreciate it. Now, our next two speakers, I do want to share this. They came on board, I guess, Monday night. Our two other speakers, unfortunately, was a husband and wife, and the husband was admitted to neuro ICU and on a ventilator. He just got off the ventilator today, thank God. They're treating him for meningitis, so we're hoping that Frank and Andrea are doing well. So Jackie, thank you for coming on board today. Jackie came on board last night, I believe. Jackie, you're so quick. Jackie has been a nurse for over 18 years and has worked in a variety of settings, with the majority of her career in the addiction field of nursing, serving as a clinical nurse as well as director of nursing services. Jackie currently works for SIPOC Medical Health Clinic, where she performs comprehensive health screens to identify health conditions, coordinate care, and provide referrals to Orthodox Jewish community. In addition, Jackie also works per diem providing home detox to patients in their home. Jackie is a certified mental health registered nurse. She's a crisis prevention interventionist, and she is also an MSN candidate in the psychiatric mental health nurse practitioner track at Monmouth University. Thank you, Jackie, for being here. And Andrew was also last minute call-in. I thank you, Andrew, for jumping on board. And when I asked Andrew for a little bio, I'll read what I wrote, and then I'm going to add what he gave me because he's a very humble man. Andrew has been a nurse for over 30 years. He has worked in a variety of health settings in his nursing career. Upon graduation as a nurse, he jumped right into the ICU. Since that time, he has worked as ICU clinical coordinator, critical care preceptor, staff nurse, a case manager for the Recovering Monitoring Program of New Jersey. He is currently a full-time employed as Associate Dean of Faculty of Students at Chamberlain University in North Brunswick, New Jersey campus. Last year, Andrew received his MSN in nursing education and is currently a director of nursing practice student at Chamberlain University. Now I'm going to share what Andrew gave me to speak about. He said Andrew was raised and currently lives in New Jersey with his wife Karen and his cat Haley, and has been a nurse since 1992. It is the only professional job he's ever held. In his spare time, he fundraises for New Jersey State Nurses Association, rides his motorcycle, and enjoys his family. And Andrew believes it is his duty to give back to nursing what has been given freely to him. Thank you, Andrew. And that was a nice little humble little couple lines you gave about yourself. Thanks. So we're going to allow Michael to go first. And Michael, you take over, and I'm going to stop share screening. Go ahead.
Hi, Suzanne. Thank you for letting me be part of this presentation. It's been a while since I've actually shared my story, so it feels good to actually be live and to share it with others. So I'd say I'm 41 now. My addiction started when I was in my late teens, early 20s. I was living a double life. kind of just going to give a little synopsis of my background and then say how I got into the ADT program and then where I'm at now. So I was living a double life. I thought I was kind of like bi-curious, bisexual, but I knew growing up in the environment I grew up in, I was not allowed to be. It was not a thing. Um, so I forced myself to be attracted to women. I met my daughter's mother. We were together 6 years, loved her to death, still love her today. We're best friends today. But it just wasn't there. We were about to get married and I ran. That having a daughter at a young age, getting through nursing school is really when I started suppressing my feelings through prescriptions, through family doctors, working in an ER as a tech and a secretary until I graduated nursing school. It was a very small ER in Hamilton, New Jersey called Kessler Memorial Hospital, where the doctors were like family to us. We called them brothers. Well, they were all old enough to be my dads, but the other nurses called them brothers. And like, we're a small family. So none of them believed I really had a problem. So they would write me whatever I asked for. I also had a family doctor because I was a nurse who also believed in me and thought that my chronic pain was real. I got really bad tension headaches. So every month I would get a prescription for Furoset and for Ibuprofen and for Xanax because of my anxiety. Still couldn't come out to my doctor or tell her why my anxiety was so bad because she's from a nationality where she didn't believe in it. So I did what I had to do. I doctor hopped within my ER through my family doctor. And I just really, really got hooked on a bunch of different prescription medications. So it was really hard to live two lives. So I just kept suppressing and doing the right thing because I wanted my family to be so proud of me. Then there came a time where I wasn't good at covering up my tracks. One of my brother's friends saw me at an airport at 5 o'clock in the morning at my partner at the time that I left my daughter's mom for, or met right as me and my daughter's mom split. I was so tired at 5 o'clock in the morning. I was laying my head on his shoulder, and immediately my family got text messages. This is your brother, and my head was on his shoulder, just like tired, like. So then my family started questioning me. So then I was denying it, and I was just at a point where I just couldn't take it anymore. I'm high 24/7, numb, not feeling anything, and it was just I was the cliche saying that they say in the rooms, I was sick and tired of being sick and tired. I was just running constantly. One day I told my family, came out to them, stopped lying. I'm like, you know what, it's now or never, and I got to accept for what it is. My family completely disowned me, kicked me out of the house, said goodbye. By that point, it got worse. I'm a functioning ER nurse at this point. I'm on 12 milligrams of Xanax a day, not to, share too much about it, but high doses, function. No one knew I had a problem. And luckily for me, at the time I was so angry at her and I couldn't see why. And she was like a mother to me. She was a nurse practitioner. We worked in the fast track section of the ER where we gave IM Dilaudid and IM added, like every IM you can think of, in and out, in and out. One day she thought I was under the influence by actually diversion, and called me out on it. And I said, no, when I showed her the vial, I said, here's what you ordered and there's nothing left in here. So that night they let me finish my shift. So I'm like, okay, like that was just like if she was having a bad day, it was busy, like whatever. The next day I got a phone call not to come to work, that I was being investigated. And then I was told I wouldn't be turned into the board of nursing because they're just going to investigate me. And if, they'll come back to me. The very next day, I got a phone call from my boss that I was fired. And 5 minutes later, I got a phone call from the RAMP program saying that if you don't do what we say, you'll never be a nurse again, basically. So that, having a young child, not being happy in life, I was just like, I'm not throwing away my career. As soon as they told me you have to do this, I surrendered right away. And I went away to the lighthouse in Mays Landing. Now I believe it's RCA. I did my 28 days there. I went through detox. I went through residential and went right back into RAMP because I started RAMP in October, but didn't go away with insurance problems. My insurance wouldn't cover Florida insurance for some, or Florida rehabs anywhere. I know they like to send you away your people, places, and things, but mine sent me 10 minutes from home, which benefited me because my family was right there to drop off anything. if I needed anything. But it was just, I went in still closed-minded. I wasn't an addict. I was just hooked on prescriptions as a nurse. I'm better than everyone here. Basically judged everyone. I had no clue what addiction was. My idea of addiction was needles and people who went to needles or people who put stuff up their nose. And I was just like, for the first 2 weeks of my rehab, I was like, I'm a nurse that just had a problem with prescription. They want me off of it because it's dangerous for to dose someone. I didn't understand that I was really a addict by definition because I was numbing everything that I've been living the last few years. Probably since my mid-teens to early 20s, I was just numbing everything 24/7, just numb. Being a dad, even though I was present in my daughter's life, no one knew I had a problem. I was just like not there. Um, so I went away, went right back into ramp, and that's where I met Suzanne, who is the president of this meeting and organization. Um, I was scared. I didn't know what an ADT was. I walk in and there's a bunch of people looking at me and I'm like, do I belong here? I don't know. And then like once I found out it was a place where nurses meet with other nurses weekly to discuss whether it's work related, once you actually got back to work, or personal, financial, anything, we're all going through the same thing. But yet at the end of the day, we're all professionals, so we can share that level too. So I'm doing my thing in the what we call the Recovery Monitoring Program of New Jersey, or RAMP. I was clean and sober, but I still had addict thinking. I just it was all new to me and I wasn't understanding it and I wasn't getting it because yeah, I was still in denial, but I just wasn't using. And I didn't want to be judged. And I'm like, oh, if I tell people I'm a drug addict or I went to rehab, they're going to judge me. So me being me, I still had addict thinking, addict behaviors, which that group really helped me identify. There has been many of times where I would show up to group, and because of rehab and my addiction, I had a truck up for repossession. I would have to hide the truck, sneak into the meeting. It was a bright yellow truck. You couldn't miss it, but for somehow I hid it for an entire year. It was an ongoing joke forever. Because I hid this truck. I had a garage where I was living with my roommate at the time, hid it in there. Like the only reason I used that truck, and I thought it was okay. I was running from the law. I was running from a repo company, and I thought that I was going to outsmart them. And this yellow truck haunted me for at least a year before I finally just said, you know what, just take it. Like I don't need it. I'm more fear. Like again, it's all addict thinking. I was thinking that I was getting away with something that I really wasn't getting away with. I got frustrated during ramp. It's a very hard process. If you're not ready, it's not going to work. But if you're ready, but confused and lost or just frustrated, you just, that's what they're there for. It was my safety net for 5 years, random drug testing, weekly meetings. Once 12-step meetings, 90 and 90, everything they made me do, I'm like, this is just to be a nurse. Like, I don't even want to be a nurse anymore. I go to a meeting one day and I tell Suzanne and I share with my group, I said, listen, I don't want to be a nurse anymore. I'm like, I'm done with this. Not that I wanted to go back out and use, but I was just frustrated. It's a long 5 years, but you know what? At the end of the day, that 5 years saved my life. With the callings to Affinity Lab 7 days a week, even on Sundays, going out of state, knowing that if you're out of state, you're going to get selected. I've been out of state multiple times, or I was out of state multiple times. I got selected and had to find a lab in like Ocean City, Maryland, Rehoboth, Delaware. I'm like, it was just all starting to cave in on me. And I was just like, I don't want to do this anymore. Then I found out that as a nurse, if you don't want to work as a nurse anymore, and you held a nursing license, you can no longer work anywhere that is accredited by Medicare or Medicaid. So now I can't even get a job anywhere if I quit nursing. What am I going to do? Pump gas the rest of my life? I don't see myself doing that. I didn't throw away or go through all of this education and blood, sweat, and tears to get my nursing degree just to throw it away. So Suzanne called me one day after the meeting and she said, listen, boy, I'm going to kick your butt. You're going to do what I say, and I'm going to be there to help you. You cannot give up. And Suzanne, believe it or not, even though she's in this meeting and asked me to speak, she is one of the biggest saviors of my sobriety, my recovery, and my nursing license, and why I am where I am at today. So I went through the 5-year program. I got let out of the program, and it was scary. It was very scary getting out too. I had that net for 5 years. I had to call 7 days a week. So even if I wanted to screw up, I couldn't, because I knew if I called the next morning, I'd get busted. And I've seen people. I saw people who thought it was okay to do stuff on the weekends that got pop positive on Monday. Like, no, like I couldn't live that life. And now I have no one to contact. I have no nurses meet in weekly. I have no lab taking accountability. Now I'm accountable for myself. That was the scariest thing. But over them 5 years, I felt myself grow so much because of the ADT program. That's what really saved my life, got me to understand recovery, got me to understand sobriety, going to meetings, getting the toolbox that I needed, knowing where meetings were out of state if I was ever having a bad night and I was out with friends in another state traveling. I go on cruise ships now. I know where they're at on cruise ships. God forbid I'm having a bad day on a cruise, which I guess is possible. It's a lot of alcohol, a lot of stuff right at your own fingertips. But there's actually meetings everywhere I go. Until today, I know where to find meetings if I ever get that urge or I need to speak or I get in a bad place. Um, so I'm very, very, very thankful for the RAMP program of New Jersey, Suzanne, just even the lady who turned me into the board to the administration at the hospital I was working at. I was so angry with her for so many years, and one day I ran into her and I just hugged her and cried, and I said, you saved my life. If you didn't accuse me of stealing and diverting and hand me in, I don't know where I would be today. I'd be childless. I'd probably be jobless. I'd probably be on the streets in Atlantic City somewhere living under the boardwalk, because it's just it wasn't a fun life. It's just I work in it now. My first job in ramp and recovery was basically you're not allowed to work in an ER, but everyone has different stipulations and different stories, and they evaluate your jobs. And I actually got a job working in mental health crisis and addictions in the ER, which is a locked unit. And RWJ in Tom's River was the first place to actually hire me. My boss there said, I see something in you that I need on this unit to actually help the patients when you're ready to speak about it. Because she knew I didn't want to speak to her about it. I didn't want anyone at my job knowing. I was embarrassed. I was mortified. I'm a nurse being watched by the Board of Nursing again. All that stuff that actually makes sense today of why these programs are in place for us to succeed. So ever since then, I've been enjoying this journey. I work in crisis there. I've been there 12 years. I'm a supervisor of another inpatient facility for RWJ. I am travel nursing. I work at Einstein in a crisis center. Again, a lot of crisis and mental health is co-occurring dual. It goes hand in hand, mental health and addiction. So I feel like I found my niche in nursing. I was an ER nurse for many years before RAMP, and I just said, you know what, it's not for me. I want to help people and be able to give back to people what was given to me, because I mean, still today, I've been out as of next week, I'll be out of the ADT program 10 years. And still today, there's minimal improvement on addiction within, you know, the patient population. They still judgmental, stereotyped. And, you know, I hope to be that voice of reason when a patient comes in all messed up on drugs and people are talking about them. I intervene and say, listen, that person is a father, a mother, a sister. Like, it's not our jobs to judge why they're here. We're here to take care of them and talk to them and hopefully be the light that gets them to rehab or get them somewhere to clean their life up. Being in recovery, I also was able to watch my daughter grow up to be a beautiful woman. I stayed best friends with her mother, which is like, you know, not a story that's heard of much. We did Christmases together for years. You know, she's remarried. I just recently got married. We were both at each other's weddings. We had special dances. You know, I was scared I was going to lose my daughter when I went to her mother and I said, listen, I know we have issues, but I have a bigger issue. And she looked at me and said, I'm giving you one chance. You go to rehab and you do what this board of nursing thing, whatever. She didn't understand it. She was as confused as I was. She was like, you do what they tell you to do, or else you'll never see your daughter again. So now I'm going to lose my education and my daughter. I'm doing everything I have to do. So throughout my life, I've remained best friends with my daughter, who's almost 21, her mother. I got my BSN from Drexel. I cruise the world. I mean, I justify still in my head with my addict thinking that I would have spent this money on drugs back in my day. So now I cruise like 4 or 5 times a year. And that's okay because now it's a healthier addiction. It costs more, but self-care is important in recovery. What else do I do? I am a year and 1/4 away from my FMP, which I've been in crisis and mental health long enough. I decided I wanted to do FMP, and then COVID hit, and I decided I don't want to do FMP anymore. I talked to my dean or my assistant dean. He told me the steps I have to take to actually just transfer into the mental health, and he will help me and work with me and speak to the people that I need spoke to. So I want to go back for my FMP and psych. I have 1 year and 1/4 left, like I said. And I recently got married to my husband. We've been together 8 years. We got married in April. We just got back from our honeymoon not a couple weeks ago. Just living my best life now. I mean, life is not what I imagined it to be. I lived in this closet. My mother and father were at my wedding. These are the people that disowned me. But right after I came out, RuPaul came out and society was acknowledging GLBT rights. And then, they passed gay marriage rights. And I gave my parents the time and space they needed because I figured it's either me, I have to be happy with me and live my life without my family by my side, or one day they'll turn around. I did not throw it in their face. I did not shove nothing in their face. I just said, this is me. You either love me or not. And slowly but surely, they came around. I'm back to being best friends with my mom and dad. I'm not hiding yellow trucks anymore. I'm just living like a citizen should be. I pay my bills. You know, I, I just am so grateful of where life has taken me. I didn't expect it was going to be this good when I got clean. I thought the end all be all was me being numb on high dosages of Xanax the rest of my life because I come from a family of addiction. So even though I didn't consider it addiction, now that I know what addiction is, I come from a long-standing family of it, alcoholism and this, that, and where there's people numb all the time and they're older than me. And I'm just like, I couldn't imagine living my life under the influence of any substances. I mean, my highs now are my friends, my family, my daughter, my accomplishments. Like they're the little highs that keep me going in life. We all go through pain and loss and grieving. COVID, I lost 2 animals back to back, 2 of my babies. 5 weeks ago, I lost another baby, 3 years old. And back then I just would have numbed it and used it as another excuse to numb. Now I just cry. I feel my tears. It's just, I don't know. And again, like my bio said, and like Suzanne said, like I owe this all to actual alternative to discipline programs. Because without that 5 years of structure and intenseness and toughness, I would not be where I am at today.
Michael, is that it?
Yeah,
Yes.
that's
Okay.
about my 15 minutes.
Okay. Yeah, that was good. No, thank you so much for sharing. If anybody has any questions for Michael, we're going to hold them to the end so that all speakers get an opportunity to present. But I want to thank you, Michael, for sharing and being open and honest. And, of course, congratulations on where you're at in your marriage and your beautiful daughter.
And thank you. And I said I did this tonight because if I can save at least one person who's suffering in our profession, I did my job. I just want to be able to help that one person that might need to hear a message. And thank you.
Thank you, Michael. Okay, next up is Jackie. I'm going to say Nurse Jackie. No, I don't know. Okay, Jackie, you're muted, honey.
Sorry, having some issues here. Okay, can you hear me? So very similar story. I'm not gay though, unfortunately. But so I guess let's see. I was a drinker basically from like the first time I drank, I wanted it every day. By the time I was 18, I was a drinker.
It
I actually went to nursing school and a year.
excuse me, Jackie, you're a little bit muffled. I don't know if it's your sound.
Oh,
Or is
hold
it
on.
just, it could be my sound. I'm in like in a thunderstorm, so I don't know.
Can you hear me now? Now? Is it okay? Yeah? Okay.
Yes, you're
Not
good
muffled?
now.
Sorry. Okay. So do I start over? So anyway, I was basically a drinker, daily drinker from the time I was like drank started when I was like 16. That was basically what I liked. I drank every day. Um, I went to nursing school right after I graduated high school. I did for like a year and a half, but then I also developed an eating disorder. So on top of my drinking and my eating disorder, I decided that school was in my way. So I dropped out. um, Drank again for the next couple years, and then I had my son when I was unexpectedly at 21, and decided at the whole time though I kind of kept staying in like health. I was like a came home health aide at one point. And I decided I really wanted to be a nurse. Like I always wanted to be a nurse. So went back to nursing school, still drinking, had my son, and then graduated and I started working on a surgical ortho neuro floor. That was my first job, and I was still a daily drinker at that point. Would just, drink when I got home. I wasn't drinking on the job. Never really liked pills or anything like that. A lot of my friends were doing pills at certain points, and I was like never into it. I was a nurse for like 2 years at this point, and actually another nurse took OxyContin at the time was part of like a protocol for patients to take after they had like hip surgery or something. And I remember she took one and asked me if I wanted some of it, and I was like, okay, I'll try it. So I did, loved it, and ended up kind of got a prescription from my doctor. He kind of caught on pretty quickly. It was like 2 weeks and I like wanted a refill right away. I told him I hurt my back. I didn't. And then I started diverting from work. So I worked on a surgical floor. So there was a lot of drugs. And I ended up I was mostly drinking. So it wasn't like a daily thing. But it ended up turning into a daily thing. I actually got pregnant and couldn't stop. So I wasn't drinking, but I was addicted to the opiates. I was terrified because I couldn't stop because I was in withdrawal. And I also was a nurse and I was a mom. And I'm like, and by the time this was my third child, um, I was married. I was like, who do I tell? Like, I'm either going to lose my license. I'm going to lose my children. So it was terrifying the whole time I was pregnant. At the very end, I got caught at work. So I was about 36 weeks pregnant. I just counted wrong. So they caught, like, it was just like a glitch. I hit the wrong thing in the Pyxis and my name came up and they investigated me. And so they called me in. It was like, I'd never told, like, knew I'd like drank a lot. I would always joke. My friends would be like, yeah, you're a functional alcoholic, but no one knew I was doing this, including my husband. And it was the first time I like said it out loud that like I had a problem when I finally admitted, because I came up with all kinds of stories to tell the hospital administration for that meeting. And I finally admitted it. They said that they would report me to the board. I remember leaving that day and thinking, like, I was like Googling what happens because I really thought I was the only nurse that could have ever done this. I was so ashamed. I was like looking up what could happen, and I kept seeing like people would get arrested, like their families, and I was terrified. They told me they would report me to the board of nursing, just wait to hear from them. So I went home, waiting. I also this is like a couple weeks. I guess at this point it was like 37 weeks. So I was about to have a baby. So I also went through withdrawal without telling anybody while I was pregnant. And so by the time I had my son, I had not taken anything for about 3 weeks, I think. And I got a call actually from the board of nursing, no, the ramp ramp the day after I got home from the hospital with my son. Um, they were like, you have to go to rehab. And I was like, what? I'm like, like I haven't used anything. I'm good. Like, and they're just like, oh, and also like just to put it in there, I thought like all I wanted to do was drink. Like I don't even want drugs. Like I just need to go back to drinking. I'll be fine. That was like in the back of my head. And they were just like, no, you need to go to rehab or you lose your license. Like that's it. And I was crying. Like I had two children at the time. My other kids were 7 and 2. And then I just had a baby. They're like, you have to go. We'll give you to the end of the week. I also went to Lighthouse in Mays Landing because they usually send people to Florida, but they were like, we'll keep you in New Jersey because I live in New Jersey. Although Mays Landing was 3 hours away, so it didn't really matter because they were like, they can visit, but I'm not because I'm making my husband bring my kids 3 hours away, 3 hour drive. But I left my son when he was 5 days old. It was the worst experience of my life. Um, I at that point though, so basically all my life I kept saying like when I have a kid I'll stop drinking. When I have the second kid I'll stop drinking. When I get married I'll stop drinking, and none of those things ever did happen. But the minute they told me they were going to take away my nursing license, I was like that's it. Like I can't give that up. I knew that like if I said like no to that and let my license go, and thank God I didn't know that like you could lose your license and reapply for it and join ramp later. Like I was just told like it was now or never. Um, I just remember thinking like if I walk around the rest of my life, see people like in scrubs, like I was just gonna like they were just I'd probably kill myself. It was really like the last thing I didn't like the one thing I didn't want to lose. Um, so I did it. I cried every day. I met a nurse that was working there in Ramp, who worked there at the time. So I remember her telling me like, there was like hope again, because I thought I'd never work again. So that was nice. But I was still not like buying the whole like I'm gonna like stop drinking. I thought maybe I could like get around it. But I came home from rehab and then I did outpatient. I did not want to stop drinking. I would go to meetings. I was doing everything I was supposed to do. And I remember saying that I told everybody like I was gonna have a huge party after 5 years and like just get wasted, do every drug possible after I got out of ramp. It's like a big plan. But I would say so like going to one of the things you can do is go 90 meetings in 90 days. And I remember by my 90th meeting, that was like when I finally, because I was miserable those first 90 days. I actually almost quit. I was like, I'm just gonna I'll be a nurse, I'll be a bartender. Like I had a whole plan. And by 90 days, like I remember just finally like breaking down to like my sponsor at the time, who I just gotten to check off a list, saying like I can't, yeah, like I can't keep coming to AA and like wanting to drink. I need to like either join this or like, just go back out there. So um I ended up working eventually when I was allowed to work again. And part of ramp, like, I used to always say, like, I would have never ever walked into an AA meeting if it hadn't been for ramp. There's no way. It literally saved my life. I would never have done that. The fact that I was forced to go was like, it's the only reason I went. I ended up getting a job. We have to tell our employers that we're in ramp. So it was you have to also, it's kind of difficult. My job wasn't going to take me back. I ended up getting a job at a detox. And it was funny because when I went to nursing school, originally, I remember the psych unit, the psych rotation, I was like, I'll never do this. Like, I never wanted, this was like horrible. I did not want to do this. I ended up loving it. I ended up getting my certification in addictions, got my psych and mental health nursing certification. While I was in ramp, I got my BSN. I left my bad marriage because it was a really bad marriage. Never thought I could do that. And moved out with my kids like on my own. By the time I was out of ramp, by the time it was like the last 2 months, I had divorced. I had moved away, like an hour away, lived on my own, had my BSN, had certifications. I've been working in detox, where detox is like my love. Um, and it basically it saved my life. I ended up 2 years later, I went back and became a peer facilitator for ramp. I've always said I wanted to do it. Well, not when I first started ramp, but at the end, that was like the one thing that I loved. I think like Michael said, like, you can go to AA or like whatever it is, a 12-step. It's very embarrassing still to say you're a nurse that like took drugs. Like even in AA, people will look at you. Um, and that was, I never thought I was gonna say too, like I thought I was the only nurse that ever did this. So when I found out there was a whole program of nurses that did this, I was like, going into that meeting that day, I just remember finally like being able to like the shame I was carrying around, and everybody, we were going around in the room and like all these people, basically, I think like 8 out of the 10 people that were there had all been diverting drugs. And I'm like, and we would like talk about it and like, we'd laugh about it, but like it was like something that is not laughable by most people in 12-step meetings. So it was I feel like that was super helpful because a lot of shame, especially as a nurse, like we take care of other people. So it was a lot of shame to say that, we were doing this. And so I really loved the peer support meetings. It was a very nice, very good experience for me. So I said I wanted to do that. So I did that for a couple of years and I loved it. It was great. It was a great experience. I ended up getting a job as a director of nursing, like an hour away. So I did have to leave it. But it was like one of my bigger stories. Since then, I have, I've been working in detox mostly. I was a director of nursing twice. I helped open a detox up in Massachusetts for the company I worked for. I do home detoxes. I've worked in methadone clinics. I'm very big for NAT. I've done a lot of work on myself too. Like it didn't just end there. I've done a lot of mental health treatment. Because I don't believe that this is just something you wake up with. It's all about pain, what pain we have, and we're trying to cover up some pain, whatever it is. So it's been, a great journey. I am now I'm at Monmouth University getting my Psych NP. I have about a year and a quarter left too. Very excited about that. Right now I work at a behavioral health clinic just because I haven't had any primary behavioral health experience, although it does go hand in hand, but I love it. It's been wonderful. But I do love addiction. So I really actually hear they don't have a lot of experience with it. So anytime someone says substance use, they're like, Jackie, go see Jackie. So, and then whatever, like life is good. I don't know. I just, it would have never, if I ramp, is like terrifying as it sounds, like I really would never have done any of the things I did if it wasn't for that. I know I wouldn't have walked into an AA meeting, and by the time I did, I would have probably lost everything. So, I'm really grateful that these programs are out there for nurses because, this is a big problem, but I think that's it.
Thank you, Jackie. Thank you for sharing. Thank you for volunteering to come on at the last minute also too. I know you may have to run if you can hang on a little bit longer, but I know
Okay.
that you might have to run. But I do know that. I'm
Yeah.
aware of that. I don't want
Okay.
people to think you're buying it out after you leave.
Yeah. No, I
Okay.
hang up for a little bit.
Okay. Andrew, you're up. Batter up.
Hey, batter up. How are you guys? Good to see you. Andrew Haviland here. Some say I have the perfect initials. At least that's what my wife says. If you get that joke, you're ahead of the game. Let me see if I can share my screen here. I have a little quiz for you guys. And this might cause Jackie and Michael a little PTSD here. Can you see this? I don't know if you can actually see it. Do you see what I see? Okay. All right. If you're laughing, that's a good thing. Okay. You see, when I signed that 4/22/2010, I hadn't quite met Suzanne yet. However, let me stop sharing this now. Okay. I keep this in my office. Every job I've had since I got out of RAMP all those years ago, I keep it in my office. People don't even notice it's here. I kind of have it somewhere in a prominent space, but people don't see it. I'll just put it back over here on my bookshelf. In my current position as Dean of Students at Chamberlain, no one knows that I was in RAMP. I haven't disclosed it to anybody, but in every other position I've had, I've talked about it. So I'm 57 years old. I started drinking in my 40s. for some reason. The first time I had alcohol, because that was my main problem with substances, started at a frat party at University of West Virginia when I had a football scholarship. Went to a Kappa Alpha frat party, and man, they had grain alcohol in a 55-gallon drum, and I was stirring it up, and I had some of that, and that transformed me into a different person. Social anxiety disappeared. Seemed like it was a good thing at the time, but all those years later, it took a toll on me. I didn't really drink too much more in college. I got a little taste of it, but I was too busy to really worry about it. But I did have the addictive mentality of foot on the gas pedal all the time. That's how I played football. That's how I did studies. That's how I did my academics. That's how I did everything. And that turned out to be my downfall later in life. So I ended up getting a job. I became a nurse. I had a couple of ICU jobs. I ended up becoming a director of a large cardiovascular department, the largest in the country at that time. And it was a great thing. I was 35 years old. I had a $19 million budget and dozens of nurses. And I had that foot on the gas pedal all the time. It was kind of a little bit of an endorphin rush for me. I kind of enjoyed it. But to bring myself down, I rediscovered alcohol at that time and I started drinking. Let's say you really haven't lived until you've done angioplasties on somebody while you've been drunk. You know, some people say they can drive better when they're drunk. I thought I could do angioplasties better. I'm not proud of that. That was a terrible thing. I ended up 16 years ago as well, going to Robert Wood Johnson in New Brunswick, where I currently am right now. I'm actually in New Brunswick, but at the school, not at the hospital. The school, that hospital is just a few miles from here. Remember, they had a strike 16 years ago, and I brought a team of nurses from Texas in. We did all the angioplasties and open heart surgeries and all that stuff. And I did a lot of angioplasties there while I was drunk. Again, not proud of that. So I stopped doing that. I go back down to my parent hospital, and I get caught drinking at the hospital. I had vodka in my office. Next thing I know, I'm asked to leave, so I leave. I try to sneak back in the hospital the next day. My key card doesn't work anymore. I'm locked out of my office, but I still have my mechanical key. I open the door, run upstairs, say hi to the security guard, go back to my office, and get the bottle of vodka that was sitting on my shelf. And I poured it down the drain, and I left, and I never went back. But they reported me to RAMP. And that was probably the best thing that ever happened to me. So I got reported to the New Jersey monitoring program. And the director at the time, the director before Suzanne was there, told me to pack my bags because I'm going to Florida. Within 24 hours, I was on a plane to Florida. Ended up in Lantana, Florida, and I met a lot of unsavory people there. At least I thought they were, but they were just like me. I remember I was having the pause syndrome at that time. I remember my roommate not showing up because he got high in the airport. He was a heroin user. So I was there 5 or 6 hours. He comes in and he's high, really high. And he says, "Hey, MF, how you doing?" And he starts getting, and I'm not feeling so good at this time. And I discovered that the studs in that Florida rehab were pretty far apart because at 6'3", 250 pounds, I pushed him through the wall to the other room. The people in the other room were quite surprised that I did that. And I actually ran out of the rehab. And I said, "I'm not doing this crap." And I tried to get away. Some of the staff there reined me in and talked to me, and they gave me my own room, which was kind of cool. Spent 64 days in Lantana, Florida. Learned a lot of stuff, dried out, got my head together, and I learned the landscape of my life and why I did. I think I discovered why I did and why I felt and why I acted the way that I did. So that was the start of the recovery journey for me. So after signing the RAMP contract in April of 2010, I came in, met a whole bunch of people. At that point, I was willing to do whatever it took to maintain, or actually to regain myself and to redeem myself. And I said, someday I'm going to help other people go through this process. And I'll explain a little bit how I did that. A lot of people many people say that they want to give back to recovery while they're in the recovery process in the early phase, but not a lot of people do that. But I did that, and that was purposeful on my point of view. I spent 5 years in ramp, did everything that they asked me to do, was a model citizen, really didn't feel like drinking or want to drink. Got my life back. I've been married for 30 years. My wife accepted me back. My son accepted me back. Had a hard time initially in ramp because I couldn't work. They kept me out. Right now, the current paradigm is about 3 to 6 months you're out of work. Back then, it was about 1.5 years for me. I couldn't get back to work. It was because I wasn't approved by ramp to go back to work. I wasn't doing anything wrong necessarily. They just didn't feel I was ready. Okay. So I ended up going to a hospital down in South Jersey and talking to a ramp facilitator who worked there full time. And God bless her soul, she has passed away since then. You know who I'm talking about, Suzanne. And she recommended me, and I got a job there. I went from the director of this big place to a job working as a staff nurse in a step-down unit. Quite a humbling experience, but I was ready to be humbled. So I took that job, and I spent a few years there. And while I did that, I decided I was going to go ahead and go back to school and do all kinds of things to improve myself. So I did that. In fact, I'm still in school, about halfway through my doctorate right now. The doctorate has a focus on substance abuse. All that was because of my experience with RAMP. So I spent some time there, eventually got my master's degree and started teaching not too long ago, actually, and fell in love with it, and somehow got promoted to dean of the largest nursing college in the country. I don't know how that happened, but when I look back, how it happened, really, it's attitude, doing the right things, saying the right things, coming to work prepared, and having a positive attitude. I got that. I had a little bit of that growing up, but I really got that post-ramp. While I was in the ramp program, I was learning how to do that. And when I got out, I certainly got that. And I understand that being positive is a big part of everything. So my success is directly attributable to the recovery process. Certainly, I had the drive, the intelligence, and the willingness to do everything I needed to do in my career to be successful. Ramp really put me over the top. Recovery had really put me over the top. So I thank Suzanne for helping me with that while I was in ramp. And I can't thank that program enough. In fact, I liked it so much that after a few years of working at that step-down job, I called up my friend Terry, who's the ramp director at the time, and said, I want to work for ramp. I came in and she goes, you really want to do this? You're not going to make any money. I said, I'm ready to humble myself. I went there, made half of what I was making 10 years prior to that, but spent 5 years there taking care, 4.5, taking care of ramp participants. And it was my privilege to do so. In my current position as dean, they know that history that I had as a ramp case manager. And that was one of the deciding factors to bring me on board at this university. So it really did help me. That wasn't my intention in doing that job, but it just turns out that it was a good thing for me professionally. So I can't thank Terry and that program enough for teaching me the humility to do the job, take care of those patients or those nurses to the best of my ability. And then I moved along after a while. Next man up. So somebody took my place. I helped train them, and now I'm here at the university. So it was a great experience. I wouldn't have traded that experience for anything. I have little ramp tchotchkes all over my office. Nobody knows what they mean. It's funny today. One of the faculty called me today and said there were students at the end of the program. I teach some of the end of the program classes. They said, well, Andrew, I've got a couple of students that when I mentioned how to apply for their Board of Nursing license, they were a little worried about what they should say on the application because they had a history. I said, okay, so let me come in. And I was able to say a lot of the things that Michael said and a lot of things that Jackie said to these students today. It just coincidentally happened today. I went in there, discussed ramp with them, discussed how to answer those questions on the nursing board application, and talked about recovery. and talked about what it means to be in recovery. I didn't disclose that I was in recovery, but I kind of broached that topic. And afterwards, several of the students came back to my office with me, and we talked a little bit more in detail about, what the recovery process means. Again, they don't know why I know this stuff, but I know it personally. So what a journey. What a journey from a drunk guy in a hospital doing angioplasties to the dean of a college. What a hell of a thing, right? The students are benefiting from my experience in RAMP. And I often, because I'm doing into the program, I often have the opportunity to talk about it. So what am I doing in my recovery life besides all the stuff I just described? Well, I do go to meetings. I go about one meeting a week. That works for me on Sundays. I go with my friends that I have made in recovery. I have a sponsor. I talk the talk and I walk the walk, generally speaking. I became, because I ride motorcycles all the time, I always did a lot of philanthropy. And part of that was I had big motorcycle events in New Jersey and all that stuff. You ever see on TV where there's like 1,000 guys riding down the road? Oh, I was probably one of them, or I was the director of one of those rides. I also have those flyers in my office too. And so I hooked up with a recovery motorcycle group, which is the biggest one in the world. It's called ARM, Association of Recovering Motorcycles. We have chapters in Sweden, Australia. We just opened up a chapter in Japan. And we've got thousands of guys all over the world. We're not the Hells Angels. We're not rabble rousers. We don't get crazy. We just a bunch of weird looking dudes that ride motorcycles and don't drink or use drugs. That's about what we do. And we have fun. We go to meetings together. We travel all over the place. I bring my wife with me. I'll just ride to West Virginia for lunch, just for the hell of it. We do stuff like that. And while we're doing that, we'll hit a meeting and we'll talk about recovery-based stuff. So we do all kinds of stuff like that. I basically have changed my life to revolve around recovery. And when I step back and I look at my life now, I can see how influential recovery and RAMP has been in my life. And it's just a wonderful thing, It's a new way of living. Now I get to actually do scholarly research on recovery. And one of my favorite things to do is to actually make scholarly connections between 12-step processes and the scholarly world of academia. And it's funny how that big blue book that has an amalgam of historical religious writings over centuries, how powerful it is. And I've been able, through published research that I have, to show that the precepts in that book actually work. Like I just wrote a paper based on the mind, body, and spirit of recovery, because there's a lot of organizations, specifically in Sweden. I was doing some work with some Swedish organizations that said the best recovery outcomes are when you take care of your mind, your body, and your spirit. And isn't that what recovery kind of essentially is? We sort of, as nurses especially, don't take care of ourselves in all three of those aspects. So it's a great thing to have that opportunity to do that, and gave me a nice doctorate project to do as well. So I appreciate recovery very much. Last thing I'll say before I let you go is my last day in RAMP, I was driving in my brand new car that I had because I was sober, driving down 295 in Cherry Hill, New Jersey. And somebody calls me on the phone that's on this call right now and said, Andrew, you just graduated RAMP. Congratulations, right? I said, really? I was expecting to graduate from the program. And I sound shocked. And I said to her, is that it? Is there anything more? She goes, what the hell do you want, a medal? And after that, I hung up the phone. She doesn't remember saying that to me, she said, but she said that to me. And I hung up the phone and I went to the meeting, and it was great. I just life has really come together. So I'm going to continue to do what I do and to give it away to other people, to give people what was freely given to me by all the nurses in New Jersey and some of the people on this call. So I could not be more grateful and have more humility than I currently do. I really enjoy my life, enjoy everything around me, and I'm appreciative in a way that I could not have been without my journey that I've gone through. It's not going to stop either. I'm going to just keep doing it because it's a great way to live. And if you don't believe it, come hang out with me for a little while. We'll have fun. We'll tell jokes. We'll do all kinds of stuff and have a good time because that's what we do. We're not a glum lot. We really aren't. So thank you for letting me ramble on for like what seems like an hour, but I appreciate being on this call. Thank you for inviting me, Suzanne.
No, thank you, Andrew. I think when you said that you wanted that award, I said you want a certificate instead. I'll make one for you.
You probably said something like that, I'm sure.
I
But
think I did.
that was funny.
Hang in your office,
Yeah,
Camp graduate.
I should do that. I should do that. That's funny.
Yeah.
Thank you.
Does anyone have any questions or any comments? Please just come on. You don't have to type them in. Please just unmute yourself if you have anything to say or any questions you have for any of the speakers. Anyone? I saw some comments, but please unmute yourself if you'd like to say something. Patricia?
Hi, can I say something to Jackie?
Yes.
Hi, Jackie. I am working in an addictions unit currently, and this is a group of 14 nurses. We're taking the second class today of 3 to prepare for the CARN. I just want to know if you had any advice. We keep hearing how it's a really difficult exam to pass, and we saw some of the statistics where they have just as few as 80 nurses nationwide taking it, and maybe they have like a 75% pass rate. Any advice?
You're muted, Jackie.
I think we could probably, I know, sorry, I got it. Can you hear me? I keep hitting go to hit the button and it disappears. Well, actually, I think maybe, I don't know.
Hi,
Suzanne
Jackie.
answered that better than me, but I mean, I don't know. I took it a long time ago. So, I, I feel like when I just working in the field was helpful, having that knowledge. And I think I did a study course actually with I think I met Suzanne there actually, because I think I met Suzanne right before you became the president or whatever you were for AMP. And right, we did the study course. Do they still do that?
Well, Susan Blacker will probably know more about,
Okay.
she worked
Yeah,
with
just say-
ANCB, the credentialing.
Okay.
So there
Yeah,
you
I
go. So
Thank
she's
you.
an
Yeah,
expert.
I was the president for a couple of years.
Yeah.
And I am CARN certified since 2010. No, yeah, 2010. What I can tell you is there's a really good course by the Graken Addiction Center out of Boston University Medical Center. It's totally free, and I think it's in
Okay.
2 parts. So
Can you put it,
that's
can you put it in the web, in the chat box? So she
yeah.
can grab it.
Yeah.
Oh, okay.
Yeah.
Thank you.
Yeah. But you know, just study real hard. It's very general. That's what I have to say. What you do at your particular site may not be the
Right.
right answer because they're looking at across the country. So
Okay.
it's very general kinds of things, procedures and things, but just study your heart out.
Okay.
Let me
Thank
look
you.
up that website for that. It's a really good course. And the person who's running that center and that course is also an ANCB, and she's been there forever too.
Oh, it's Colleen LaBelle, right? Because I'm on the Great
Colleen,
Addiction,
yeah.
website. Yeah.
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 So it is good. They have a lot of information,
Yeah.
educational,
Mhm.
webinars, free webinars.
Yeah, they're
So
free.
They're
Yeah,
all
I do them
free.
all the time. Yep. I
Yeah.
do them all the time.
So if you
Yeah,
need to
they're
keep up your CEUs, that's a great place to go.
Thank
it's free.
you.
Yeah.
Sure. Let me get this
Well,
here.
she puts that in, Susan puts that in there for anybody to grab. Does anybody else have any questions or comments for any of our speakers? Tim, you could speak. Tim, did you want to speak or you just want to type it in there? Did everyone see what Tim put in? Oh, microphone is broken. Okay. Did everyone see what Tim put in?
Yeah.
Yes. Okay.
I
Good.
just
Good.
I
Thank you, Tim.
would like to thank everybody because I know that's part of the recovery process is sharing your story, but your stories are so very different, but so very intimate. And the fact that you can share them, I've always said that people who go into rehab are the most courageous people I've ever met. Especially when I was working in detox, and that people would come into the unit and they'd be broken and, you know, have all the horrible feelings that they have when they first come in. And I'm like, but you are so courageous. You're here. And the fact that you three share these very intimate details of your life and how it's turned around, and you're being so productive and so wonderful in your life now and sharing it. Just like, it just like really moved me a lot.
Yeah, I'll say I happen to know everybody at the panel here. And they were chosen for a reason. You know, they're all successful. You know, sometimes they try to give me credit. I didn't do any of it. You guys did all the work. I
Yeah.
mean, you know, we may have given you some information, bring the horse to the water, but you drank it. You guys took off, and your careers are, you know, amazingly just everything you're doing, Jackie, Andrew, Michael. You know, I'm so happy for every one of you, you know. It's just for me, it's like heartwarming to see like this, you know, alternative programs do work. Years ago, we kicked nurses to the curb. We publicly disciplined them. It was very shameful. Now nurses have a place they can go confidentially and share, and they can get on to recovery. They do get a safety net around them to help them, nudge them along sometimes. But Michael, that was for you because Michael had to get nudged sometimes. But I it's statistically healthcare professionals have better outcomes. And I believe it's because of the monitoring for 5 years, the safety net that's put beneath them. My neighbor would never get, you know, the safety net that a nurse would get. And I believe that this is why the healthcare professionals have better success rates because of the support they get. It seems a little tough sometimes, and you know, but the bottom line is it's about public safety, but it's also helping the nurse, and we want to make sure that your nurses are safe to practice. So, but yeah, I applaud you, all three of you, for coming on today and sharing your story. It's heartwarming to me to see everybody doing so well, and it's a good feeling, you know. Anything else? I get teary-eyed when I see people that I love and doing so well. I do. I do. I can't help it. So, yeah.
I want to
Okay,
say
well,
when I spoke real quick, I didn't get to thank you, but you did a lot for me. You know, you were one of the ramp people that came along. You were my favorite one, but you also helped me get my card. You helped me. I went to the INSA conference twice because of you. I was able to get the scholarship. So you've done a lot for me. So I appreciate. I'm glad to do this for you. So thank you.
yeah, it's all about giving back and paying forward. That's how I believe my life should be. So, and you guys are all paying forward, you know, tough a baby comes. Love you, Michael. Okay, that's it. Anything else for anybody? I don't know. Some other people didn't get a chance to chime in if they have anything to say. We have a couple of minutes left. If not, please be sure to complete the survey. It'll come up on, you may have already received it via your
Yeah.
email. Once you complete the survey, you'll get your certificate. If you're not a member of American Society of Addiction Nursing, I encourage you to join us. We, you know, share the word. We do these webinars. Actually, Susan Blacker, she orchestrates all these webinars every month, and for our members, they're free. So it's 12 contact hours. Our membership is very minimal, and we hope to see you next month. And what's next month? I don't have it. I didn't put it on the schedule.
Next month is maternal risk perinatal. I forget the exact title, but it's Tony and Rosemary.
Okay, perfect.
Well, I can speak for that one too. No, just kidding. Just kidding.
Well, don't worry. We'll recruit you. We'll recruit you later on for next year. And Andrew, don't think you're off the hook either.
Uh,
And Jim
Understanding
and Ed,
perinatal populations at risk.
okay. Yeah.
And
So,
November is going to be something to do with mindfulness
Mind-
and substance use.
mindfulness,
Yeah.
great topic, great topic. I think we're taking a break in December. I don't know if we are or not. It's
I
it's
have to
Susan's
Probably
role.
run, but I have to run.
Okay.
So thank
Okay,
you.
thank you, Jackie,
Thank
so
you,
much.
Jackie.
Appreciate you jumping
Bye.
in last minute. Thank you
Thank
so
you.
much.
No problem.
Yeah,
Bye.
Michael and Andrew, thank you so much. I know this was like a, hey, can you speak? And you guys were like, sure, I'll do it. Didn't even hesitate. And I so appreciate, Michael, you jumped on right away. Thank you so much. And Andrew, you jumped on last minute. No hesitation from neither one of you. And I so appreciate it.
It's what we
Um,
do.
Yeah, yes, yes, you do, Andrew. I love that you have that ramp contract.
That's funny. Every job, I always have it with me.
Yeah, that's nice.
I have
Nice.
Affinity's number still in my phone 15 years later.
I don't
case you have
doubt
to
that
check
at
in.
all. I
In
don't
case
doubt
you have
that
to
at
check
all.
in.
For how many? They're probably for at least good 2 months, 3 months after. I would still look at my phone every day. Like it was just such habit after 5 years. I always keep that number in there in case. Just reminds me when I see it pop up. I'm like, I used to have to call that nightmare 7 days a week, 5 years in a row.
And look at you now.
Yeah, look at me now.
Look at you now. Married, father, your daughter's beautiful. Life is good. Going on cruises all the time.
All the time. I love it.
Yeah, yeah, yeah. Life is good.
And then I'm coming to Tampa soon.
That's her own. Let's still going to the Eagle game.
Yeah.
Yeah.
All right, I have to run and get ready for
Okay.
work.
All right. Thanks, Michael. Thanks. I know. Okay.
Thank
Take
you.
care.
Bye,
Good
everyone.
seeing you. Okay. Good
Bye.
night,
you,
Thank
Mike.
everybody.
you.
Thank you for coming on. Andrew, can you stay on?
Sure.
Yeah, just a chitty chat real quick. Susan, you can stay on too. Anybody can stay on actually. Um, great presentation, Andrew.
Oh, thanks.
Yeah, I was really it was great. I never heard your story. I don't think I remember your story.
Yeah. Well, you've heard like 1,000 stories, so it's hard to remember
Yeah,
everybody, you
it
know.
it yeah, no, I
I
don't
was
know if
under
I,
when I was in ramp, I was under the radar. I did what you said. If you said to dye your hair blue, I would have done that, whatever, you know. So my name probably didn't come up in the ramp team meeting very often. I
no,
wouldn't
you never came up. No, but you were the voice of reason to fellow members.
Yeah, that's what I tried to be.
Yeah, you were definitely a voice of reason when people were like, ah, you're like, oh wait, let's look at it this way. This is what I think, and
My
I
whole
remember that.
practice in nursing has been about reasonability. I still do it now. So when I'm talking to students or talking to faculty, you know, what is a reasonable thing to do? Because
Right.
people get off track with all that stuff. You have to balance policy and procedure and what you do and say and think with reasonability. People are just getting
Yeah.
crazy these days.
Yep.
And,
Yeah, yeah.
somebody has to be that voice, and all of you on this call are probably like that too, I'm sure.
Right. Yeah, but I remember you being the voice of reason in the group. I remember that. Like a steady force, just
Yeah.
saying it like it was.
Just don't give
Yeah.
me alcohol, because then I lose that whole reasonability idea.
Yeah, I don't think we want to give you alcohol.
No,
Life
please
is
don't.
life is good. You got a great life. I'm so happy for you.
Why do I remember Patricia Jones's name? I don't know why I remember that name, but that's sticking in my head somewhere. I don't think I worked with her, but I just know that name. I must have heard it before.
You're muted, Patricia.
Well, it's a common name that I've
Maybe.
discovered, especially
Okay.
in nursing and also like going to hospitals and stuff. When I go to an appointment, they will cross-reference everything to make sure I'm the right person.
Yeah,
So it seems
sure.
like it's a really common name. But I'm
Patricia,
here
are you a member of ASAN?
I'm not a member. I forgot
how
how I
How did you hear
discovered
about
this.
this? How did you hear? I'm
I don't know.
curious.
I don't know. To be honest with you, I think I may have discovered it in researching some stuff for the Carn, I think. I don't know how it
Hmm.
came across, but then I think maybe it was just 2 weeks ago, and then I saw this was coming up, so I said I would join this session. Yeah.
Okay. Come, look at our, go
Keep
back to our
coming.
website.
Keep coming back.
Keep coming back. Look at our website. Come join us. You'll see
Okay.
us. You'll see us. Yeah, we look for new members. We look for new ideas, fresh ideas. We're about 3 years,
This is
4 years,
two,
Laura.
going into three.
Yeah. Yeah, 3.
3 years.
Yeah,
Oh, okay.
yeah.
So
No,
it's
Bill was.
new. I
Yeah.
thought you was
No,
already
Bill.
been
No. I think we started in 2020
Yeah.
okay.
So we're going into three.
officially. Yep. So we also accept LPNs. We're the only professional organization to accept LPNs too. And we have student rates up there, Andrew, too, just an FYI. Wink,
You know
wink.
what? I think I
Yeah,
just
yes.
remembered something. When you said LPN, did you have an LPN who led a course about methadone programs?
Yes, we did. That's
I did.
Irene.
That's the first one I attended, maybe about a month
Oh.
ago, I think.
Do you work in methadone? Do you work in methadone? Is that where you work?
No, so I work in inpatient addiction in a hospital base.
Oh, nice, nice. Where at is it in Jersey or where at?
No, it's in Westchester. It's in St. John's, Park Here
Oh.
Pavilion. It's in Yonkers.
Okay. Oh, nice. Oh, okay. Oh. Are you a registered nurse? Yes.
Yes, registered nurse.
Okay.
Yep.
Yeah. No, because I know there's a National Association of Licensed Practitioner Nurse, LPN, is a conference in New York in October.
Okay.
We'll be there.
At that conference. Oh, well, you know what? I think we have 3 LPNs left at the hospital. Unfortunately, like they didn't hire any new LPNs for the past couple of years, but there's still 3 that have been working there. So maybe I can tell them.
Yeah, there's an 8-hour course on addiction on Saturday.
Okay,
That's
That's
the
a conference. That's a
Yeah.
conference.
Is the
Yeah.
conference on Zoom? Is it on Zoom?
No, it's not our conference. We're invited. We're invited as an organization, and we're doing a
Oh,
8-hour
okay.
presentation for them.
Okay.
Yeah, let them know.
I will.
Yeah,
I gotta try.
and let them know about
I'm
the
gonna go back
organization.
to the main website and find out.
Yeah, that won't be on
Mhm.
there. You have to go to the NALPN, or
Oh, okay.
if here you can email me, and I'll give you the information. Hold on, I'll
Okay.
put
We
my
should put
stuff
it
in
on the
here.
website, Suzanne.
Yeah, we should. I'll get Robert too, because we'll be there. Oh, I
Yeah,
said
that'll
that.
be good.
Come on.
I'm
Come on.
sure they would love it, especially one nurse in particular that I work with him. He's interested in a lot of different treatments and things that are up and coming in addictions. But even this class that we're all just taking the second of the 3 for the CARN, they said he's not eligible, because it's only for registered nurses and advanced
Right.
practice nurses. So
Right.
he
Right.
didn't get a chance to participate in that one.
Yeah, I think what is ANCB looking at? They're looking at a
They've
certificate.
been looking at
for-
it for years, yeah.
Okay,
But yeah, a certificate, not a certification.
so, but that website that Susan did give you, Patricia, that Grayson, whatever it was, I've been on that website. I don't have it handy myself.
But
it's
yeah, but it's addiction training, nursing.
Yeah,
Okay.
there's so
whatever I
much
put in,
information
addiction
on there.
training.
Yeah, there's
A
so
lot of
much
different
on there.
courses
Yeah,
for peer support for people who are not nurses. Then there are nursing courses and every kind of substance, and then all the latest things. They have a 2-part CARN review.
yeah.
It's just, they're talking about xylazine and stimulants and alcohol and anything you could possibly want to know about. They run these courses.
I found it, addiction training at Graykin Center. Graykin. Mhm.
Yeah. And they're all free. And
Thank
you
you.
get a CEU for them too. So
Yeah, that's good because I've been trying to hours. You need to have 30 hours
right.
Yep. Yeah.
And they're free. That's
to take that exam.
unbelievable. And they're
Yeah.
very good. They're all evidence-based. They're all run by experts who specialize in whatever the topic is.
Okay.
And if you join us, you get 12 free credits a year.
That's right.
Oh, okay.
And it's a very low membership fee.
It's a
Very
low
low.
membership fee. Okay, let me look
Yeah.
on that one too.
Yeah, 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 yeah.
Yeah, this
So,
has been great. I'm so glad to
okay.
connect with everybody tonight. And it was
Yeah,
really
thanks for
wonderful to
coming.
hear how, like you said, intimate and personable, everybody just sharing their experience and how they overcame it. I think that's the best part. I think you don't get to hear a lot about that. Not so much nurses, because I can't say that I have had any experience with treating nurses, but other professionals we have. And this seems to be, even after recovery, there seems to be a lot of struggle. You don't really hear about this level of success that I heard about tonight. It's my first experience.
Yeah.
Yeah. So that's great. I'm happy to
And,
hear
and there's
everybody.
and there's thousands of other nurses out there. I mean, there's thousands of nurses that go through programs and graduate and move on. One of the other nurses I know, she's getting her DNP. She's probably
It's amazing.
graduating next year. Yeah, there's a lot. Everybody moves on, and I always think, Andrew, and you can say this, there's a lot of high achieving nurses that get
Yeah.
Well, that's generally, our mindset is that we are high achieving and high functioning. And so it takes you by surprise because you would say, well, I think I'm smart. I think I know what I'm doing. I think I know my own body, but you take care of everybody else but yourself. And sometimes
Yes.
being intelligent works against you because you figure out ways to cheat the system and to do things and that the ordinary person wouldn't even have the background knowledge or experience to do. Like we know how to cheat a drug test. We know how to do all those things. This is why nurses monitor nurses in these programs because we know all the ins and outs. You can't bullshit me when it comes to
Right.
bullshit.
monitoring
Yeah,
somebody.
yeah,
right?
yeah, yeah,
I know what you're trying to do, so it's interesting. The whole nurse thing is just an interesting thing.
Yeah.
And sometimes we just don't take care of ourselves, I think is the bottom line. And that's something that I bring forth in school when I talk to the students. We talk about self-care all the time, in fact, because these students today are working full time. They have
Yeah.
several kids sometimes.
Yeah.
They're also in school 8 hours, 10 hours a day with the studying involved. So they're not taking care of themselves. Every nurse in RAMP, every single one had the nursing diagnosis of self-care deficit. Every single one. So that's
Yeah.
the prevailing factor why we come in.
Do you have any actual courses on substance use in your program?
Yeah, we have a whole mental health track. So we do go
But that's not a whole course.
It's not a full course. There's components of it. So I often insert myself into the curricula to talk about RAMP or alternative to discipline because I can do that because I'm the boss. So I go in there and we talk about alternative to discipline and we talk about recovery pathways. And I sort of give them a little information about that. And it's a very small part of the curriculum, but it is in there.
Great. Yeah, it was great. It was great seeing everybody. Patricia, it was nice seeing you back again.
Yeah, thank
that's
you
ni-
so
and-
much.
Yeah, and Andrew, it was great to see you in person. Haven't seen you in
Yeah.
a couple of years.
Yeah,
So,
it's good to see you
and
guys.
Susan, I see you all that now. I see you once a month.
All
We're in the
right,
same
we'll be
state.
talking.
Yeah,
Yeah,
yeah. Okay, thank
I'm
you,
out.
everybody. Have a good night.
All
Good
right, take
night.
care.
Thank
Good
you.
night.
Good night.
Bye-bye.
Thank
Bye-bye.
you. Okay, bye-bye.